Hi, this is Zach Miller calling in.
How are you, Zach?
Good.
Boy, what do you think of this weather we've been getting, eh? It's been kind of back and forth.
Yeah, really all up over the place.
So, when did you come down with the coronavirus?
So I first got sick near the end of September. So my symptoms started developing on a Friday. Started pretty mild. Started with a sore throat in the morning. But by the afternoon, ended up going into more achy joint and muscle pain, and had that for most of the weekend. I basically had every symptom I'd say in the book in terms of the main symptoms with COVID. Started having the muscle and joint pain, which lasted over the weekend, and that was really an odd experience because when you first get it, you feel like you're just having a sinus infection or some mild cold or that. And like I know for myself, I typically will get some sinus infections around this time of year with the weather change and that sort of thing. But then once it got joint aches and muscle pain, that's where it really started to feel odd. And so it developed into that, which is a weird experience because you'll be in pain when you're sitting down or laying down, so you have to get up to move around a bit to not be in pain anymore. And then you start getting tired when you're walking around in that, so you just have to lay down. It was sort of this continual cycle for a few days of that. And then I started getting a chest cold over that weekend and runny nose and all that sort of thing. And then later in that week, I started developing the fever around Tuesday, Wednesday. And had a pretty high fever by the Wednesday night of that week. And it's always hard when you have a fever because you don't really know. You're trying to cool down, drink a lot of liquids and that sort of thing, but taking medication and such. But it can be a hard experience, especially just not knowing what each day is going to bring, because for me, it almost felt like every day I was getting a new symptom and overcoming the one from the day before. And then by the time the fever finally broke for me, later on that day, even on the Thursday, I started losing my sense of taste and smell, which is another really odd experience where your smell, you almost can smell like burning metal constantly, which makes you feel nauseous. And then the taste is odd because foods you're used to tasting all of a sudden taste really bland and almost oily in a sense, which again makes you feel nauseous when you're just trying to get better and you don't have that much of an appetite anyways, but you're just trying to eat to get better, right? So, and then once my fever finally broke, went into more of tiredness. And honestly, that lasted for a couple of weeks, even after getting cleared by public health once my fever was done. When I first started getting tired, near the end of that period of time, probably after about 8 or 9 days for me is when the fever was done. The tiredness was like overwhelming tiredness in a sense where I would just eat like a little bit for breakfast, and then all of a sudden you'd feel as though you just woke up from a sedative from like getting your wisdom teeth pulled or that sort of thing. And I experienced that for probably a couple days, and then finally started feeling a little bit more normal. But then after that, then you're dealing with this sort of brain fog feeling where you have a hard time like forming words and thinking common words that you're used to saying. You just can't think of it quick enough, or and just even the tiredness. So that honestly lasted for I'd say about 3 or 4 weeks, 4 or 5 weeks even, until I fully started to feel a bit more normal again. So yeah, it was a long experience for me. Like I said, it was late September is when I first got it, and I'm still have some lingering effects from it even now.
Wow. That's a common thing that we've heard from previous survivors is that they have lost their sense of smell and taste as well.
Yeah.
So what are some of the things that have stayed with you? Some of those lingering effects.
I'd say the main ones for me is like when I was sick that week, was broken up sleep patterns where I was waking up at 3 or 4 in the morning and was like wide awake sort of thing and couldn't go back to sleep again. So that lasted for a few weeks, I'd say. So some of that's still off and on even now, where I wake up way earlier than I was ever used to waking up before and just can't go back to sleep in that. And then like the brain fog, it's a hard thing to describe, but it's you take a bit longer to process things, because the thing with the virus, it really goes after all the different systems within your body. So it's primarily a respiratory virus, but it can go after other parts within your body, and I think very much that's what happened to me. So yeah, it's and the thing is, everyone has a different experience with it too. Like, I've known people that have had more milder cases where they've just had sort of the runny nose and chest cold, and they feel fine afterwards. But then I've known other people that have even had to be hospitalized from it and such too.
So how was it for you then, Zach? Did you were you able to stay at home, or did you have to be hospitalized?
Yeah, so at that time, my wife and I were actually in a social bubble with my parents. We just only interacted with them basically through the summer, because we were leading up to my wedding in October, so we were trying to stay as safe as possible, kind of thing. So we just were interacting with them. So they had actually started developing symptoms before my wife and I, and by that point we were already all sick, kind of all together. So we basically just isolated all together within the same household, because we were already with them by that time, kind of thing, and just happened to be that we developed symptoms around that same time. So that was helpful in that sense. I couldn't imagine going through it on my own, kind of thing. But being with my wife through it, and my parents as well, I think was helpful for all of us, just to kind of keep our mind focused and cleared. And because, like I said, you don't really know what the next symptom is going to be, or if you're going to wake up the next morning and have something new, or any of that sort of thing. So,
wow, yeah, the unknown is so scary.
Yeah, and I think the thing with me is, like, I've been a part of the pandemic response in the community since the very beginning. So, I mean, I've known a lot about all these different cases in other countries and in the States, in New York, and that sort of thing. And you hear about these cases of people get the symptoms, and then they all of a sudden the symptoms get quite severe quite quickly, and then they have to be hospitalized, and sometimes they don't come back from that. So those are the kind of thoughts that are racing through your head when you have it, when you're positive. But like I've told others who have come positive, like you just can't allow your mind to wander into places it doesn't need to go to, and things that haven't even happened yet. So, wow.
So on top of all of that, you were getting ready to take your vow as well.
Yeah.
Oh my goodness. So how did that go?
It ended up going well. The wedding went flawless, and everything came together. So we were really happy about that. But obviously, that's another thing that's gonna, when you're sick a few weeks ahead of time and already cleared by public health, but when you're kind of leading up, the month usually leading up to your wedding, you're finishing up all the final planning, right? But adding COVID to that didn't really help that process. So,
wow. So you did wind up getting married anyway.
Yeah, we got married still.
That's good. Well, congratulations.
Thank you.
And it's so happy that you actually made it through without even having to go to the hospital. So that's a good thing. Knock on wood.
Yeah, like my wife and I were okay in that sense, but I did have some other family members that did have to go at that time. They didn't have to stay too long, but even that sort of situation to experience definitely isn't enjoyable at all, where you see like a family member having to get picked up by the paramedics kind of thing and taken to the hospital. And I mean, just really not knowing if that's going to be the last time you see them or if they're going to come back. But I was really thankful that like my family member was able to come back after the fact and was able to join us at the wedding and that sort of thing as well. So.
Wow. Yeah, that would be very scary because, well, people that wind up going into the hospital with it, you're pretty much put into isolation, right?
Yeah. Typically, depending how severe your symptoms are, like that assessment's done by the paramedics on the way in, and then the decision's made at the hospital. But yeah, like the thing is, when you're sick, you always get called by your public health nurse that is your case manager at the time. So we had our nurse calling us every day, kind of thing, in the afternoon and checking in on us and checking in on our symptoms. And And where that family member was at the time, the public health nurse advised that they go to the hospital just because what they were experiencing then. So,
wow. So, besides the lingering effects that you had afterwards, have you suffered any negative effects from people towards you just because of the fact that you had COVID?
I don't know. It's been mixed in a sense. Like I'd say family and friends and that sort of thing, like coworkers you've known I've had it and such, like they've been really good about it and understandable and that sort of thing. But I think those that don't know you that well and don't know how you caught it, you kind of get labeled right away, and you can almost be treated like a leper in a sense, where it's like, oh, you were a positive case, I'm going to stay as far away from you as possible, even if you've been cleared by public health and such. And I think that was kind of the biggest thing I know for my family, and I was just going through that in different ways and experiences and such. So,
and you know what, Zach, I've heard it said from some healthcare workers, anyways, that's really the way everybody should be carrying on to begin with to protect ourselves. We need to treat each other as if we do have it.
Yeah, exactly. Well, that's the thing. Like, but I think the most important thing to know is, like, once you are cleared by public health, like that's their call to make on that. But I think the thing is to not label people right away that those that have it. That it's not always people that have gone out and gone to large social gatherings, or they're going to the restaurant every single night, or any of those sort of things. But sometimes, like for my experience, I got it just because of other family members, and it spread like wildfire through my family. Like once one of us caught it, so you don't know, I guess, how people have caught it, and it's not always because they had reckless behavior or that during the summer or fall. So I think we just have to be really careful not to label people who have had it right away, and try to, as a community, come alongside them and support them through it.
Yes, I agree, and it is an airborne disease too, after all. So it's definitely a good idea to protect ourselves.
Right.
So, we still heard about it in social media a lot too. Like I happened to mention this morning that I still see in social media where there are people that don't believe this is a real thing. Well, what advice do you have for some of those people?
Well, I guess in that sense, like we've been discussing this since the beginning. I know with our response team is trying to dispel some of those myths. But I think for my experience, after actually having it and knowing family members that have had it, this is very much a real thing. It's not something to fool around with or to try to take lightly or that. Like, I think it's important to keep taking the public health precautions, even if you were positive and you were cleared by public health. Like, you still need to be wearing masks out in public and washing your hands and only interacting with household members and those sort of things. And I know from experience, like those public health precautions do actually work. Like my wife and I were with someone else the day before we even knew we were sick, and before symptoms even developed, and that person didn't catch it from us because we wore masks and we kept our distance from them, and we took all the right precautions and that sort of thing. So, like, they work. I know from a personal experience, those public health precautions do work. Masking actually does work. And we see that in examples in other places as well.
Mm-hmm. So, in closing, do you have anything further that you'd like to share with us, Zach?
I think the main thing is I guess just from my own personal experience, and I think even to the younger population in the community, like, I'm in my late 20s. I'm not someone who's in my 40s with multiple comorbidities or later in life or that sort of thing. And I think for the sake of the elders in our community and others that may be immunosuppressed or may not even have things that they're aware of, underlying conditions, I think for the sake of them, we as a community have to come together and protect these individuals. And if you do want to go out and have birthday parties or other things, get-togethers and such, I guess I would just say to that, like, just hold off for now. It's 1 year right now. Like, we know there's a vaccine coming in the future and potentially even the near future. And I think right now the thing is just to hunker down and hold off and maintain those public health precautions we've been sending out since the beginning. And I just know that we as a community will get through this. So I guess the thing is just keep calling people, keep texting, connecting with others over social media. Just because we have to physically distance doesn't mean we have to socially distance from others. And I think as a community, if we come together in this and that we will get through this, and we'll be stronger at the end of it all as well.
Well, thank you very much for sharing your experience with us, Zach. I know it took a little bit of courage on your part to be able to do something like this. And again, congratulations on your nuptials.
All right. Thanks, Al.
We'll talk to you later.
All right. Bye.
Bye-bye. And don't forget, everyone, if you are suffering from any of those symptoms, there are two numbers that you can call locally to get yourself tested. 1-855-977-7737. Again, that number is 1-855-977-7737 or 226-446-9909. That's 226-446-9909. And as well, I know a lot of our personal physicians are suggesting that we get our flu shots to protect ourselves, because that would further complicate matters if you did get COVID. They are taking appointments now here at Six Nations for their flu clinic, either electronically or by landline. And they are making appointments for Tuesdays, Wednesdays, and Thursdays. If you'd like to get your appointment made electronically, you can go online to sixnationsfluclinic.as.me. That's sixnationsfluclinic.as.me. And by landline, you can call 226-227-9288. That's 226-227-9288. And yes, get your flu shot and stay well.